Hello, I'm Dr. Eugene Corbett from the Department of Internal Medicine here at the University of Virginia. I'm here today to participate in a history and physical examination with a standardized patient. We haven't met before, but the purpose of this is to provide an opportunity for you to observe how a physician might perform a complete history and physical examination on a patient who's new to them. Mr. Murray, I'm Dr. Corbett.
Nice to meet you, John.
Yes, sir. Nice to meet you. Yeah, first time we've met.
Yes.
Yeah.
Yes.
So I understand you made an appointment for an examination.
Yes, correct.
And we're going to, a complete physical examination, I understand.
Yes.
And I'm going to ask you about why you came into that, but will you mind if I take a few notes just in case?
No, that'll be fine.
In case you got lots to tell me. Don't want to miss too much.
That'll
Is
be
that okay?
fine.
Good, good. So you made an appointment for an exam. When's the last time you had a physical examination?
Probably 2 years ago.
2 years ago.
Yeah.
Okay. Well, tell me why you made this one.
Well, I had these chronic headaches going on that I've had for about 3 months now, and they're just not getting any better, and I want to see if there's something we can do about it.
So when you say chronic, you're referring to the fact that they've just been steady for 3 months, or they've been longer than that?
Well, it started 3 months ago, and they were like every other day or so, and now I'm having them every day. And
so you have no days when you don't have a headache?
I have a headache every day.
But at the beginning, it didn't seem to be quite as noticeable then for you, huh?
No.
Describe the headaches. Where are they, and what do they feel like?
They start at the back of my head here, and they kind of come up around my temples, I guess you call it, and into the front of my head. Sometimes they're throbbing. You know, other times they're not quite as bad.
Yeah. So it's both sides of your.
Yes.
It starts in the back and comes up the front.
Correct.
Do you have a headache all the time, or does it just come in episodes?
Well, I have a headache all the time until I take something. I take Advil and Tylenol that seem to help it, and that eases it up.
Is it ever gone? Is it always something there?
There's always something there. I always know it's there. It's just the intensity of it.
I see. Can you tell me a little bit more about what you notice? For example, when is it the worst? At night, in the morning? Or doesn't it make a difference?
Well, it doesn't make a whole lot of difference. When I don't get enough sleep, it's really bad. If I move my head in a certain way, or if I strain or stretch my head in a certain way, it seems
like
to be
what
worse.
way? Can you show me that?
If I go like, you know, to the back, or if I'm, you know, bending over, just any exaggerated moves.
Any exaggerated move makes it
seems
worse.
to make it worse.
Yeah.
And if I don't take the Advil and the Tylenol, it seems to be worse.
Makes it worse too. I see. So this 3 months ago it started. It's both sides. It's in the back, and you can make it worse if you either extend or lean forward for too long. Is
Yes.
that the idea?
Just I call them exaggerated head movements.
Yeah. What happens when you're lying down? Does that ease it or make it worse?
I think that eases it some.
It does.
You know, especially if I can get some sleep.
I see.
It seems to ease it up some.
So the act of lying down and sleeping doesn't make it worse.
No, I wouldn't
Makes
say
it better, maybe.
Yes.
I see. I see. Does it change based on if you're eating, for example?
No. You know,
Does eating make it worse or better?
No, eating doesn't seem to.
So having a full stomach doesn't seem
No.
to bother it at all either, huh? How about if you're concentrating, is when you're driving or reading?
No, it doesn't make it worse, except when it's really bad. I have a hard time focusing.
Okay,
You
yeah,
know.
that's helpful. Yeah.
Yeah.
Does it ever seem to be more one side than the other?
No, it always seems to come up and be just kind of like meets in the middle.
Meets in the middle, huh? Starts in the back, goes around, meets in the middle.
Like a tight band.
Yep. And the part that's always there is what? In the back or all over?
I would say in the back.
In the back
Yeah.
there too.
It
Yeah.
always starts in the back. I got rear-ended in a car accident, and I can remember my neck got jerked, and I had a sore neck for a couple days, and then the headache started shortly after that.
So that accident started this thing off.
That's when it all
So
started.
you had no headache before this?
No, I had no
That's helpful.
previous headaches.
So
before
somebody,
that.
tell me about that. How fast were you? Were they going?
Well, it wasn't very fast. It was in a parking lot, and I was backing out, and somebody else was backing out the other way, and we met. And I just remember that jerk of my head
Gotcha.
and having a stiff, sore neck. for
So
a couple
both
days.
cars couldn't have been going more than startup.
Yeah.
Okay.
5 miles an hour or something like that.
Did you strike your head when that happened?
No.
That you recall?
Not that I recall.
Yeah.
I just remember it kind of being, I guess they call it whiplash.
Did you get out of the car right away?
No, I sat there for a few minutes and then I got out of the
Did
car.
you?
It startled me.
Did you?
Yeah.
Then you said the headache started after that. How long after the actual accident did the headache start?
3 or 4 days after.
So it wasn't right away. There was a
Wasn't
little
right
bit of
away,
a warm up.
yeah.
There was a kind of an interval in there where you
Yes.
felt fine. I see. Did you think that you had hurt yourself?
I didn't think I really had hurt myself. I didn't,
Mm-hmm.
I felt startled and, just kind of shaken, but I didn't feel like I was really injured.
But didn't. Okay.
I didn't go to the hospital or anything like that.
Yeah. Have you? And you said you take some things for it. What actually helps it? What do you?
Tylenol and Advil.
Mm-hmm.
I take, I guess it's,
How much do you take?
I take a lot. I take 16 Advils, 4 tabs, 4 times a day,
Wow.
and I take,
Self-prescribed?
yes, 2 Tylenols 4 times a day. So I'm taking
8 Tylenol and 16.
24 pills a day.
Advil. Wow. I take it you warmed up to that. That you weren't using that at the
Right.
beginning.
I started out
Ah,
with
I
less
see.
and it wasn't working, so I just
I
kept
see.
adding to it, and it does give me some relief.
It's a lot of medication.
It doesn't, yeah, it seems like too much. That's one
Does
of
that-
the reasons I came to see you.
Good for you. Yeah. Does that mean it just keeps getting worse?
The headaches just kept getting worse in the severity of them, yes.
Yeah. 'Cause that's a lot of medication.
Yes.
Before you had this accident, did you use those medications much, if at all?
No, very
No.
seldom.
No, never had to take that kind of thing with
No.
any regularity at all?
No.
Okay, okay. I need to know too, what else do you experience? Anything else? Does this make your body feel different or painful or uncomfortable in any way?
It makes me feel stressed. I feel stressful with it. I can't sleep well. It's uncomfortable.
Yeah.
It's just kind of a nagging thing that's there all the time.
Gotcha. Does it bother your shoulders, your arms? You feel anything down here?
No, no,
Strength,
pretty good.
tingling?
No, not really.
How about just being able to use your arms in normal motion?
Yeah,
That's
I-
not disturbed at all?
No, that's fine.
I see,
That's
I
fine.
see. Wow, so you had an accident, took a couple of days for this thing to get to you, 3 or 4 days,
Mm-hmm.
but then it started bothering you and persist, and now almost has this stubborn worsening. Is that what I'm,
Daily.
daily? And what kind of work do you do?
I work in a car dealership. I'm a service manager.
Oh, yeah.
Yeah.
So has this had an impact on your ability to just do your normal stuff?
Well, again, it has in that it's uncomfortable. I feel stressed because of it. I'm able to do my job. I
So
like
you
my
can
job.
do your work? You're not,
Yeah,
have you missed any days from work?
I think I missed 2 days in the beginning, but I've been at work since then. I'm able to go to work, but I make sure I have my Advil and Tylenol with me. Other than that, I'm
You
working
sound like a great
okay.
employee to me. To work through this kind of thing is pretty difficult.
Well, I like what I do. I work on vintage cars on the side.
I see, yeah.
And so I
Okay.
try to make it.
You know, I have a sense of what you're telling me. What's your diagnosis?
I don't know if I did something to my spinal column back there. I don't know what you guys call it, but something happened when I got hit, is what I think. A jerk did something. Other than that, I
Changed
don't really
something,
know what it is.
But you're fairly sure there was a couple of days in there where it wasn't obvious to you that there was anything wrong.
Other than it just being sore.
Okay.
It was sore and stiff, but the headaches didn't start, like I said, until about 3 or 4 days later.
So there was some discomfort
Yes,
right
there
away.
was.
But you would call it more a soreness or stiffness
Yes.
than an actual headache that like you're
Right,
having now. Okay.
right.
Gotcha. Yeah. I need to know a few more things
Okay.
about the effect of this on you. How's your sleeping? Do you sleep okay?
And I don't sleep well at all.
Why not?
The headache, the discomfort, it's hard to get to sleep. I sometimes can get to sleep and then the headache wakes me up. So my sleep patterns have been totally
So that's
disrupted.
So how much sleep are you getting at night compared to what you like to get?
Well, I used to sleep the night through, which was probably at least 8 hours. And I'm probably up 3 and 4 times a night now.
Wow. And how long has that I would call it a sleep deficit. How long has that been going on?
Well, this happened 3 months ago, probably 2.5 months now, because it wasn't as bad in the beginning, but they did just get worse.
Yeah. Did you consult with anybody else, or you've been just toughing this out on your own?
Just been
Pretty
toughing
much.
it out on my own and
Yeah.
trying
Okay.
to, hoping it will go away, but it's just getting worse.
But you have been able to do your work, think, use your hands?
Yes.
Nothing,
Yeah.
nothing disturbed in that way, huh?
No.
Gotcha. Anybody else know? Did your wife, are you married?
Yes, I am.
You've been
Yes.
talking to your wife about this?
She certainly knows
What's she been saying to you?
that I need to get somebody to look at it. You know, she realizes that it affects my whole life.
I see.
Yeah.
Yeah, okay. I'm going to get back to that in just a second, but I'm
Okay.
curious about a few other things. How's your general health? Tell me, how young are you?
I'm 54.
54.
Pretty good health.
Mm-hmm.
I was diagnosed when I was 45 with high blood pressure. Not real high, but a mild case of high blood
On a
pressure.
routine exam, or were you sick?
No, it was a routine exam.
Mm-hmm.
I've had my appendix taken out. I've had several other surgeries.
And the appendix was removed long ago?
Long
or-
ago, when I was 14.
When you were
I was
14,
a youngster.
I see.
Yeah.
Uh-huh.
I had a hernia repair.
What type? Here or down in the
No, up here in my chest area.
hiatus hernia?
That was
Like
it.
Oh, I see.
That was it.
And about when was that done?
It was done about 6 years ago.
Gotcha.
Yeah.
So your appendix was at age 14,
Yes.
and then you discovered you had high blood pressure 9 years ago when you were 45.
45. And let's see, I think the hernia was actually longer than that. I think I was 32, so it was 22
So
years
it's a
ago.
dozen.
Yeah.
Uh-huh.
That was a while ago.
Gotcha. Gotcha. And are you on treatment for your blood pressure?
Yes, I am.
What do you take? Do you know?
HCTZ,
Yeah.
take that.
Hydrochlorothiazide. That's a diuretic.
Yeah, that's what it is. I think it's 25 milligrams
25?
a day. And then I take another
Do you
one.
take it
Yeah, I do take
pretty
it.
pretty regular?
Yes.
That's the only medication you take?
Well, I have another one. It's these long names I'm not good with. Lisapropanol.
Lisinopril,
Yeah, I think that's it.
probably.
Yeah, 10 milligrams
Okay.
once a day.
Okay.
And I take a baby aspirin
Oh, you do?
once a day.
And how long have you been taking the aspirin?
I think I started taking that shortly after they told me I had the high blood pressure.
Yeah.
About 9 years.
So you have a physician who has known you for a while. about
Yes.
this. Has your blood pressure been under good control?
Yes, it has.
So you've never had headaches from that?
No.
So this headache isn't anything?
No, it
Doesn't make you think of blood
No, it
pressure?
doesn't.
Okay. Gotcha. So you've been, anything else to tell? Any other
The
medical
only other
problems?
medications would be the Tylenol and Advil.
Oh, yeah. Mhm.
Yeah.
And Tylenol is about, you said 8 a day.
8 a day.
And then the ibuprofen, you call it Advil,
Yeah.
right? And that's 4 times
4
4.
times that, yes.
Okay. Is that all medications?
That's
You take
everything.
vitamins,
No.
iron, nothing like that?
Nothing else.
And any other medical problems that you know of?
Well, I had my knees replaced. I've had back surgery in my lower back.
Well, you've been through a lot, huh?
I have been through a lot.
When were these knees fixed? Different times? Or?
Different time. No, the knees were both done at the same time.
Uh-huh. Mhm.
They were done. The back surgery was first, then I had my knees, and then I actually broke my arm. Had to have my arm fixed.
Just so that I have a sense of this, how long ago did you have the knees replaced?
The knees were replaced about 2 years ago.
2 years ago, huh? So you were 52 then, huh?
Yes.
Just got bad. Just got that bad you couldn't get around?
Couldn't get around. It hurt to walk.
Mm-hmm.
Osteoarthritis, I believe, is what they said it was.
Gotcha. That must be,
They're much better now.
and more functional. You can
Yes.
get around. Do they limit you at all?
No.
No. And obviously, they haven't bothered you since this accident, have they?
No, they
You
haven't.
didn't hit your knees on the dashboard?
No, I did not.
Gotcha. And then what did you have done with your back?
Lower back, I think it was
Mm-hmm.
L4, L5, herniated disc,
Mm-hmm.
and that was in 1995.
Mm-hmm. So 9 years ago, so then you were about 45 then too,
Yes.
huh? So that's about when they discovered you had high blood pressure?
Yes.
Okay. Okay, now I got you. And did that work? Did the surgery work?
Yes.
So that-
It really relieved
Gotcha.
the pain.
No, any trouble since then?
My back is a little weak, I think,
Mm-hmm.
but certainly much better than what it was. I had the pain going down my leg, the nerve pain, and that's all
So
gone.
it got one of the nerves to your leg?
Yeah.
Mm-hmm. Okay. All right, boy, you got lots to tell. Got lots to tell.
Yeah.
Okay. They're the main things. Just to pick your brain about a few more things.
Okay.
Any other hospitalizations? You've had the knees, the back, the
Yeah.
appendix,
Um,
the hiatus
the,
hernia
the
fixed.
hernia and then my broken arm.
How'd you do that?
I fell off a bicycle.
Recently or a long time ago?
That's about 4 years ago.
It sounds like you stay active anyway, huh?
I do stay active.
That's good exercise for your knees to ride a bike.
That's right.
Sounds like it wasn't good for your arm.
I
Huh?
haven't been back on it though.
And was that how long did it take that to heal?
That took probably a year before it really was completely healed.
Was there a complication?
It was just both bones in here. I think they're the ulna and the radius were shattered.
Oh.
So I had plates and pins in there. So they were broken in several different places.
I see.
And it was so badly swollen, it just, it took a long time to get my range of motion back.
see.
I never did get it completely back.
I see. But the knee, the back, and most of the arm doesn't limit you from doing the kind of
No.
work you do, all
No.
that kind of thing. Huh? Any other surgeries or
No.
hospitalizations? No. I need to know, any allergies? Do you have any allergies to drugs, food?
Penicillin. I'm allergic to penicillin. That's the only drug that I know of. And no food allergies.
What's your penicillin reaction?
It makes me break out.
Really?
I break out, I itch.
And was that something you got older or when you were a kid?
I think I was my first reaction with that, I was a youngster. And I don't remember, it seems like forever though, since I've known that I've been allergic
But
to
once
it.
you got that information, it stuck.
Yes,
So you're pretty careful about
yes.
it. Okay. All righty. Any other medical things you think I should know about that you can think of that we haven't covered?
No, we covered my high blood pressure. No, if I can just get these headaches under control,
That would be
I
a
really
key
will feel,
thing.
yeah.
Absolutely, sure.
That would make me feel good.
Yeah, we need to get this settled. That's a lot of headache.
Yeah.
Something's not right, and we'll
Okay.
be figuring this out. A few more things if I can be sure and get some more complete background.
Okay.
Do you smoke?
No,
Don't smoke at all,
no, I used to, but I don't anymore.
huh? You a drinking man? Alcohol?
3 or 4 drinks a week,
Do you?
that's it.
What's your pleasure? What do you drink?
Oh, mostly beer, mostly on the weekend.
So it's not every day. It's
No.
about 3 or 4 per
Yeah.
week, then, huh? Gotcha. Is that the way it's always been?
Yes.
I also want to know a little bit about your family.
Okay.
They healthy? What runs in your family line? Anything?
My younger brother, who is 45, has high blood pressure.
Oh, really?
I have a sister who is 48 and she's healthy. Mom is 78 and has arthritis pretty badly.
Where does she have hers?
And hers is basically in her hands. It started about 15 years ago. And Dad died when he was 65 of lung cancer. That's when I quit smoking, when he was diagnosed.
Was he a smoking man?
He was
That
a
he
smoking
smoked,
man,
too?
yes.
Oh, so you did smoke once?
I did smoke once, and when I quit at age 40.
40.
Yeah.
Just so I know, when did you begin?
Oh my goodness.
How many years did you put in smoking?
I probably smoked 20, 22 years.
So you started as a teenager then, huh?
Yes.
About 18 years old.
Yeah.
Huh? Gotcha. And then your dad died of lung cancer. So
Yeah.
then that's when you decided that was
That's
enough
when
of
I
that,
just-
huh?
Yeah, I quit then.
Gotcha. Okay.
Scared me.
Okay. Family line outside of lung cancer, any other cancers? Prostate, breast, colon? Any of
No,
those things that we need to be
no,
thinking about?
none that I'm aware of.
Uh-huh. I think that's got mostly everything in that category. Last thing I want to do, I need to kind of go through your body's organ systems so I can think about how everything else works. Is that okay with you?
Sure.
And some of this might pertain to the accident you had. How's your vision?
My vision is good. I wear glasses for reading and distance. My vision, when the headaches are really bad, when they're really throbbing, I think I said before, it's hard for me to focus. It just, you know.
And are things blurry or it's more just a concentrating thing?
Actually blurry. Yeah.
So if you try to look at something, it's fuzzy.
Yeah, when they're really, at their worst.
When headaches are bad.
Yeah.
And both eyes? Is that? Do you think it's both eyes?
I
or do
think
you
it's both
one?
eyes.
Think
I
it's
mean, I
both
can't
eyes?
read the newspaper or anything like that when they're really bad.
If the headache calms down, the vision gets better.
The vision gets better.
Have you ever had that trouble before with your vision?
No,
No. Does it make any difference whether you have your glasses on or off?
no,
And how about your hearing? How's that hearing?
hearing's okay.
Okay. Was that disturbed at all since the accident?
No, I
No.
haven't noticed anything with that.
So you can hear a phone conversation?
Yes.
and when your wife talks to you from a distance?
Yes.
That kind of thing? No trouble with that? How about things like taste and smell? Are they normal?
Normal.
Can you
Yeah.
smell usual hamburgers and food
Yeah.
cooking,
Yeah.
smoke and
I
coffee?
hadn't even thought of that, but I haven't had any,
No trouble like that either?
no change in
Gotcha,
that.
gotcha. Okay. A few other things I'm sort of going from top to bottom.
Mhm.
Trouble swallowing?
No.
Nothing like that?
Mm-mm.
If you eat, do you have any trouble with that initiating a cough?
No. Occasional heartburn.
Occasional. How occasional?
When I eat something really spicy.
Mm-hmm.
But if I do some Rolaids or some Tums, it seems to take care of it right away.
Is that often? Once a week, once a month?
Oh,
Once in a while?
Once in a while.
Once in a while. So not a regular thing, huh?
Not a regular thing at all.
Beer doesn't do that to you, do it?
No, no. Thank
Gotcha.
goodness.
Yeah. How about your body weight? Has that changed?
It hasn't changed. I'd like to change it. I'd like to lose some weight, but
What are you weighing now?
I weigh about 200.
200, huh? Has your weight changed since the accident?
No.
So this headache hasn't taken away your appetite or your ability to eat or anything?
No, I don't think I eat as heartily as I used to, just because when you have a bad headache, you're not really thinking about eating.
Sure.
I don't notice that I've lost any weight because of that.
So as far as you know, your weight's about the same
About
as it was
the
3
same,
months
yeah.
ago. Gotcha. I also would be helpful for me to know your physical activity level. Tell me,
Not
tell me
much.
about your job first.
Not
Is your
much.
job a desk job or are you on your feet?
I'm on my feet behind a desk, and I'm actually sometimes I pitch in and help turn wrenches.
Most or at the time, some of the time, or just on occasion?
Just on occasion.
So it's
my-
mostly a sitting job then, huh?
Yes. Either standing or sitting behind a desk. Service manager, you bring your car into me and
Gotcha.
we document what's wrong with it and do some paperwork and get your car fixed, and
Gotcha.
that's pretty much
So not a lot of, no sweat level activity?
No,
with that.
not really.
What do you do that makes you sweat?
yard work. I
How
don't
often?
do as little as possible. I rake the leaves, I cut the grass.
Is that a weekly thing, a monthly thing?
Well, in the summer, springtime, I'm cutting the grass weekly, and the leaves are getting ready to fall, so I'll be raking leaves.
So it depends a little bit on the weather and the circumstances.
Correct.
But you don't have a regular get out every day for half an hour and do something?
No, I don't.
Gotcha. Is that not your love?
No, it's not. I never was an exerciser. Yeah,
Gotcha.
so.
What'd you weigh in high school, by the way? Just give me a little sense of it.
I probably weighed about 165.
160. So you're about a good 35 pounds.
Yeah,
Well, what do you consider your preferred weight?
I'd like to be about 180,
180, huh?
185.
Yeah. I always like to ask people that. It kind of tells you where they are compared to where they'd like to be. Okay. How about your gut? Appetite?
When I'm not in a severe headache, my appetite is
Okay.
fine.
Can you eat anything?
Pretty much so.
Ever have any abdominal kind of symptoms from eating
No, not
or from
really.
not eating?
No. My
Stomach
wife
hurts?
cooks what she calls a heart healthy diet. I eat a lot of fiber in the morning, cereal, skim milk. We
So your wife's the designer for the most part of it.
Pretty much
And
so.
It sounds like it's healthy from what you
Yeah,
perceive
she
anyway.
really is pretty aware of that.
Tell me, any difficulty with your bowel activity?
No, pretty regular,
How often do you go?
twice a day.
Twice? Is that that's your standard thing, huh?
Yeah.
Formed? Loose? Or don't even think about it?
Don't even think about it. Not diarrhea,
But no changes?
but no
Okay,
changes.
and you've been that way for, that's been your
That's,
your
yeah,
habit.
it's
then,
always
huh?
been like that.
Gotcha. How about what I call your plumbing? Urinary habit? Ever notice anything that doesn't seem right to you?
No, I think I pee about the same as I always have.
Do you get up at night to empty your bladder?
One time a night.
Just one time?
Yep.
How long has that been the case?
Oh, a couple of years now, I guess.
A couple of years,
Yeah.
huh? So it did change.
Yeah, it did change.
From younger years.
Right, and I never used to get up.
Once. Gotcha, yeah.
It's
But
not
you-
every night, but it's,
Oh, okay, so you still have an all-night capacity, but it changes depending
Right.
on other things, yeah.
Yeah.
Gotcha. Any trouble with nature, your nature?
No.
You know what I mean by your nature?
I'm not sure, I think.
That's a man's ability to get an erection.
Yeah, no
troubles
no
with that?
problems.
Gotcha. Tell me more about your muscles, bones, joints. You've had trouble with your knees and they're better.
Mm-hmm.
Do you have other arthritic symptoms like shoulder pain, like hand pain, like foot pain, like your mother had? Anything like that?
The base of my thumb, if I pitch in and help the guys, if we're fixing a car, if I'm doing more mechanical work, I feel like in the base of my thumb it gets, I don't know if it's arthritic or just muscular.
Right there where you're pointing to.
Right there where I'm pointing
Yeah,
to.
yeah.
And if I have to get on my knees for anything, if I spend any time on my knees will hurt.
So you don't mind going down on those new knees, huh?
I prefer not to. I want to make them last.
Yeah.
But at times I don't
But
have
at
a
times
choice.
that's a problem, yeah.
Yeah.
And are you right-handed?
I am right-handed.
So is this the hand you might use if you're going to use a wrench or something like
It
that?
would be, yes.
Gotcha. Other joints bother you?
No,
No.
not really.
Were you going to say something?
Also, the arm that I broke. I don't know if there's any correlation between that pain and the arm.
Do you hurt up where the fracture was or just more down by the base of the thumb?
More in my wrist than anything. I can turn this arm all the way over, and this arm I can only turn that far. And they told me it's just that the bones were so badly shattered that the way they had to line them up, that it's never perfect again. And if it's off a little bit here, it'll be
I
off
see.
a little bit up here.
So they alerted you to expect
Yeah, some
palm up was going to be a
yeah,
little
some
bit limited.
decreased range of motion.
Is that getting better with time?
I don't think so.
I don't think so.
No.
So it's kind of fixed. And,
I'm used to it now. Yeah.
Gotcha. So you smoked for 22 years. Do you have any trouble with your lungs, breathing,
No,
cough?
no. I mean, occasional cold.
Do you have stairs in your house?
Yes,
Do you walk them regular?
yes.
Can you do them all at once, or do you have to stop along
I
the way?
do them all at once.
Do they make you short of breath at all?
They don't make me short of breath, but I'm glad when I get to the top.
Uh-huh.
Yeah.
So you notice some change. Is that any different now than it was a year ago?
No, I wouldn't say
Nothing
that.
like that, huh? Gotcha.
Maybe different than 10 years ago.
Uh-huh. Uh-huh. What do you know about your heart's activity? Ever have been told you had any trouble?
Other than the high blood pressure, no.
Have you had any heart checks related to your seeing your doctor and your high blood pressure? Stress tests or
No,
things like that?
no,
So, and when you go up those stairs, do you ever feel any pain in your chest?
no,
In fact, do you ever feel with anything, even with sexual activity?
no, no.
So things work for you.
Yeah, it
no
seems-
limitations coming
Yeah,
from that
not-
area.
not that I know of.
Yeah. And short-windedness wouldn't grab you if you were lying down for a long period of time, or
I'm sorry. I didn't-
if you're lying down, do you ever get short of breath just lying down?
Oh, no.
Nothing like that.
No.
How far can you walk? If you and I went walking on casually, how far could you go?
Well, with my knees, even though they're good, I'm still somewhat limited. I could probably walk a couple miles.
You could.
Yeah, I think so.
Do you see any changes in the past year or two on that?
I think they're getting better.
Oh, getting better.
Yeah, oh, yeah.
Uh-huh. So the knees, yeah, so they're still.
It was a long
healing.
recovery.
Yep. That's good. Yeah. Okay. Let's see, other things. Ever have any trouble with things like anemia,
No,
low blood counts, things like that?
no,
Are you aware of whether you ever had trouble with your blood sugar? Or
not that I know of.
how about your cholesterol? Have you I'm sure you've had that checked, haven't you?
Yeah, I have that checked. The last time I had it checked, it was within the normal range. I don't
Oh, was
remember
it?
exactly what it was.
So no medications involved?
No.
This is... Gotcha. Okay. Covering a lot, huh?
Yeah, definitely so.
Do we miss anything so far?
Not yet. More than I thought.
Well, we like to be sure we know as much about you,
Mm-hmm.
so we can think about other things going on here. Okay, your heart, your lungs, your gut, your kidneys, we talked about that some, your joints, and then in terms of your nervous system, ever have any problems with that? Ever have any weakness or tingling anywhere? I asked about your arms,
yeah.
how about your legs?
Maybe when I'm turning wrenches, I'll get a little tingling in my hand, which I always thought was just from whatever's right here at the base of the thumb. But other than that, and it doesn't last.
Doesn't last,
No,
yeah.
once I stop doing that
There
activity.
is a nerve there that you can
Is it?
compress when you're, especially if your hands aren't toughened from regular practice,
Uh-huh.
you can get a little bit of a what's called median nerve tingle.
Okay.
Does that ever come on by itself,
No,
or do you have to be wrenching? To do that?
I have to be doing something for it.
Do you have
to
good
stay.
grip strength?
Yeah, I think
So
so.
that's not that changed
No.
at all either then. Okay. Well, I think we got pretty much everything. Unless there's something else you can think of.
I'm trying to think. No,
Got pretty
you've
much
asked me
everything
more than what I thought.
Good, yeah.
What
Well, let
you-
me just be sure too that before we break, because I want you to gown up so we can do an examination. So these headaches really weren't there before you had this accident.
Not at all.
And then the accident happened and you had some awareness that your neck wasn't quite supple and non-sore, as you
Right.
said. But then 3 months, it's just been progressively getting worse, and the headache does get around both sides.
Does get around both sides.
And when it's bad, it does bother your vision and your concentration, and
Correct.
stresses the devil out of you, it sounds like.
Mm-hmm.
And even interferes with your sleep some.
Correct.
But you hadn't lost weight or gone down in terms of your ability to function.
No.
Am I reading you?
I think you're reading me. I think I could function better if I didn't have these headaches. I think it's a lot of effort to function well
Sure.
with them.
Sure.
But
And the final thing is, with all the medications you take, do you know if you're having any side effects from any of those? Do you know what to look for?
You know, not that I know of, and I wouldn't know what to look for. But that was one of my concerns. It just seems like I'm taking so
That
much
is a lot, yeah.
that just can't be healthy for me.
Yeah. A couple of things, just so I know, and you would learn something perhaps. That a lot of Tylenol, that dose is probably below the worrisome level, but a lot of Tylenol in some people can cause some liver problems. And you would know that because you might turn yellow or lose your appetite or lose weight, but it doesn't sound like you've experienced any of those things, huh? And then that much of the pain medication, more common things, makes your stomach not happy, eating, heartburn, stomach aches. Do you get any much of that?
No, I get the heartburn, but I've been attributing that just to like really spicy food.
Do you think the heartburn's been worse since you've been on all that Advil?
I'm not sure.
Not sure.
Yeah.
Fluid retention sometimes happens too. You know, at the end of the day, you might know your legs are swollen. Whereas,
Yeah.
anything like that? Do you ever notice?
Well, I've actually noticed sometimes when I wear socks, I take my socks off and I have a little indentation around where the top of my sock is.
So you're not used to seeing that.
No.
And when do you think that came into the picture?
Well, now that you mentioned it, I don't think I had that before the accident.
Oh, really?
I didn't notice it.
Yeah.
So maybe that is one of the side effects.
Could be, well, we'll have to be sure and check that out too,
Okay.
because it can affect your kidneys in a way that can do that, but it also can make it keep fluid even if your kidneys are healthy, so we'll have to kind of consider
Okay.
that too. They'd probably be the main things to think about.
Okay.
Okay.
Yeah.
Well, we're going to get you to gown up and we're going to take a look at things.
Okay,
Sound okay?
Yes.
All righty.
Thank you.
All right, sir. Did we forget anything? Anything else you want to tell me?
No, not that I can think of.
Okay, we covered it
Yeah,
all.
I think we got
We
more
got it
than
pretty
what
much
I
good,
thought.
yeah. Well, now I'm going to do a complete exam,
Okay.
and basically we'll start at the top and then up at the bottom.
Okay.
I'm going to need you to sit while I check your vital signs and examine you the top, and then I'll probably sit you up and lie you down a few times.
Okay.
At the end, when I examine your bones and muscles and your neurological, your nervous system, I'll probably have you sitting and even maybe a little bit of standing.
Okay. That'd be
Does that sound
fine.
You comfortable?
Yeah, I'm fine.
If I hurt you, tell me.
Okay.
This shouldn't be painful, but you never know. People sometimes have sensitive spots, and your neck may bother you some with some of the things I'm going to ask you to do.
Okay.
So does that
All
sound
right.
okay?
Yep.
So first thing I want to do is just get your vital signs. When's the last time your blood pressure was checked?
Oh my goodness. 2 years ago?
Been 2 years?
Yeah.
It's good you're here.
Probably so.
What's your pulse normally run?
I'd say high 60s.
High 60s. Yeah, you're just about 70 right now.
Yeah.
So that's good. All righty. Now to do this, just want you to be nice and
Loose.
relaxed. There you go. Yeah.
Okay.
Sometimes if you tighten your muscles up, it makes the pressure seem higher because your muscles are contracting and
Okay.
harder to squeeze. But let me borrow your arm
All
just for a
right.
second. There you go, sir. Just want to be sure this is on there snug. So 2 years, huh, since your last had things done.
Well, I might have done it in the grocery store once or twice in those machines, but I never trust them.
Oh, but since you've been on 2 medications, it's been
Yeah.
controlled as far as you know.
As far as I know, it's been fine.
All righty. Now, you nice and relaxed there? That arm feels good and loose. Now I'm going to pump it up once to see what your systolic or high pressure is.
Okay.
And then once I know where that is, then I know how high to pump it up for the listening part.
Okay.
We just have to wait about 10 seconds in between here. So this is the arm you broke. Did that hurt?
No, I did not.
Okay. All right, sir. No, nice and relaxed. There you go. It's about 144/80.
Yeah.
How's that sound?
Sounds a little high to me.
Does it sound a little bit high? You notice I made a point to put my stethoscope on the inner part of your arm. You know why we do that?
So you can hear.
Because that's where the artery is, so
Okay.
we can just hear it better. So I just want to just
Okay.
double check that. In fact, maybe what I'll do, if you don't mind.
How did you check the high end the first time without listening?
Yeah.
That's pretty interesting.
Well, once you, I'll show you this. First of all, you put this on to be snug, and then the purpose of this is to pump up the balloon to cut off the circulation, to actually crush the artery and block it.
I see.
So by pumping it up, I should make your pulse disappear.
Okay.
And that tells me about where your highest pressure
Okay,
is.
that makes sense.
So you're nice and relaxed there again. I'm going to do this one more time,
Okay.
just to check both sides. Because that was a little bit high. And see, that's about 152/80.
Wow.
Did you take your medication today?
Yeah, I did. Maybe those headaches are doing more than what I thought.
All right, so there you go. Okay. All righty, so I got your pulse and your blood pressure, and I was counting your respirations, and you didn't even know I was doing that, did you?
No, I didn't.
Yeah, gotcha.
That's good.
All righty, sir. Now, just put your head square. I just want to check the lymph nodes in your head and neck area here. And there's all sorts of sets of them here. Have you been sick lately with a cold or anything?
No.
Gotcha. Okay, and now I want to check the eyes. Now, a couple things I need you to do. This has about 4 pieces to it. The first thing what I want you to do is I want you to just watch my nose. And I want to just check your pupils. And I think it's dark enough in here, we probably can't darken it anymore, but let's see how this works. Just watch my nose. See, that one constricts. And that one makes the other one constrict too, so that works real good. Gotcha. And then this time, I want you to hold your head still and watch this finger, but I want you to follow it. And I'm going to put my finger there just to make sure to me that your head's still. And just follow my finger. You all set?
Mm-hmm.
Keep your eye on this. Gotcha. Did that make you have any double vision?
No, it
Did
didn't.
you see one finger the whole time?
Yes,
Gotcha. Okay, now watch this finger here and tell me when you see my other finger.
right now.
You do. How about right here?
Right there.
Is it wiggling?
Yes,
Okay. Now watch this one.
right there.
What's it doing?
Wiggling. Right there.
Is it wiggling?
No.
No. Okay, good. So your movements of your eye look healthy. Your pupils react just fine. I want you to do one more thing for me.
Okay.
I want you to take a look at that light over there,
Okay.
and when I say so, I want you to look at my finger,
Okay.
because I'm going to put my finger right up in front of you. I'm going to watch your pupils and see what they do when you do that. All right? You ready?
Yep.
Now look at my finger. There you go. This time, look at something dark. Maybe that square on the door.
Okay.
Just stare at that for a minute. Now look at my finger. Now look back at that door again. There you go. See, and your eyes are supposed to dilate when you look far, and they.
Did they?
That looks perfect. You
Good.
betcha. Okay, good. Let's see what I got here. Okay, there's my scope. All right, sir. When's the last time your doctor looked in your eyes?
Last
time you were checked on?
Yeah, probably my last exam.
Alrighty. Now for this, I'm going to be looking inside your eye. So to do that, to make it work well, if you would pick up, you see the hinge on the door?
Yes.
If you just stare right at that hinge.
Okay.
And I'm going to look in one eye and then the other.
Okay.
Excellent.
It's a bright light.
Is it pretty bright?
It's
Now see what I've done. That's bright. I've cut it down to about half.
Oh, wow.
You got to have a little bit of light to see in there.
Mm-hmm.
But won't be too long. Excellent. Okay. All right, let's see if I got everything there. Okay, good. So the hearing's been fine, and since you've had the headaches,
No problem with the
huh?
hearing.
Are you exposed to noise much in your work?
A little
In the
bit.
shop, really?
Ratchet wrenches, air-driven wrenches and things like that.
Have you ever had your hearing tested to see if you've had any problems?
No.
with your hearing?
Never.
Okay. There we go. I'm going to take a look first. There you go. Ever have much trouble with your ears when you were a kid?
I remember having some wax buildup and having to go to the doctor and have the wax taken out.
But no ear infections, huh?
No ear infections that I can remember.
Now what I want to do, I want to just test your hearing for a second.
Okay.
Can you hear that?
Yes.
Okay.
No.
I'm doing it out here, and tell me about when you hear it.
Right there.
Right about there, huh? Good. I'm going to do the same thing on that side. Do you hear that?
Yes.
Tell me
Hear
when
it
you
out
hear
there?
it. You can hear it
Yeah, I
out
can
there.
hear it there, yeah. Yeah, I do hear that now.
You hear that?
Yes.
So let's do it one more time to be
Okay.
sure. So you hear that, right?
Yes. I hear that. I hear that.
You're getting better all the
I
time?
hear that, yeah, I'm surprised.
All right. Because I can hear that too.
Yeah.
Okay.
There.
So you do hear it there then,
Yeah.
huh? Okay. Let's try this instead.
Yes.
Just curious. Can you hear that?
No. There.
Right about there, huh?
There.
So right about there. So that's almost the same on both sides.
Okay.
This time I want you to tell me where you hear the sound. I'm going to
Okay.
put it square in the middle of your forehead. Is that in the middle, or is it off to one side or the other?
In the middle.
It's pretty much in the
Yeah.
middle then, huh? Now I want you to tell me, can you hear that?
No, I can't.
Is there
I can
noise
feel
in
it. I can't really. Oh, yeah.
Now tell me when that disappears.
Now.
It's gone?
Gone.
Can you hear that?
Yes.
Okay. This all tests, you need two things to hear. Your nerves have to work and the bones have to work. This helps to distinguish those two.
Oh, okay.
So, I'm going through your bone right now. Do you hear that?
Mm-hmm. Sure do.
So when it disappears, tell me.
Gone.
Pretty much gone?
Mm-hmm. There it is.
No problem. Huh? That's the way it's supposed to work.
Wow.
Yeah. And we can do that with other tuning forks, but that's pretty much the way we do that. Okay. Just a few while we're at your neck. Show me how far you can put your chin to your chest.
That's about it
And
before it
that's
starts
about it.
hurting.
Did you used to be able to do it more than that?
Yeah, I could touch my chin to
Yeah.
my chest before.
And how far back can you go?
All right, about there.
So you take your time with it, don't you?
Yeah.
How about rotating to one side and the other?
One side's worse than the other. I can go pretty well. It's about it there
Mm-hmm.
and right there.
So a little more limited on that left side then,
going to
huh?
the left
Gotcha.
is harder.
Yeah, yeah. I want to do your arms too, just to see how
Okay.
they fit in. Any trouble going all the way up like that?
No,
Does it hurt to do that?
no,
Can you put this arm behind your back?
yes.
How about that one? Any discomfort in the shoulder when you do
They
that?
feel a little tight, but
But not painful?
not painful.
Uh-huh. Can you touch one shoulder from the front
Mhm.
and then the other side? No trouble like that, huh? How about if you put your hands like this
Mhm.
and go out and back in? Any discomfort when you do that?
I can feel it in the middle of my back,
Really?
of all places.
Really?
But
Which motion makes you feel in the middle of your back?
the going out.
The going
Right
out to
like
this, so
there, yeah.
external rotation. And
Yeah.
does one side do it more than the other? Tell me.
My left side doesn't.
Maybe a little bit more on the left
Yeah.
side there too. Huh? Can you put your arms out like that? I'm going to fight you a little bit. I want to
Okay.
see how strong you are. Really tight.
Okay.
That's good. No trouble with that. Huh? Let me see your arms then while we're checking the
Okay.
arms too. Need you to make a fist
Okay.
and be really tight.
Okay.
And do this one too. Now this time I want you to push against me.
Okay.
Ready? We may have to grab hands, but push as hard as you can. Okay. And then I'm holding your shoulder
Okay.
here. Ready? And then push as hard as you can. Go and push. There you go. Good. Okay, and let me see your hands then too. In fact, squeeze my fingers as hard as you can. Really hard. Okay, now leave go of this side. That's pretty strong. Now squeeze here as hard as you can. And now I want to switch sides to the other side. Really hard. Good. And give me your hands like that. And hold your fingers apart, and I'm going to try to squeeze them together, and I want you to fight me.
Okay.
Gotcha. And then the last one, if you put your thumb and your middle finger together,
Okay.
Like this?
Thumb, okay.
and hold them tight. I'm going to see
Okay.
if I can open them up.
Okay.
Ready? That's pretty good too. Okay, good. Yeah. Okay. All righty, let's see what I want to do next.
What do those tell?
I was testing the three main nerves that go from your neck down into your hands.
Oh, okay.
The median, the radius, and the ulnar nerve.
I see.
A little bit of biology. Part of the reason is because it's part of a regular examination, but in your case, if your neck's bothering you, I'm looking for signs that the nerves may be a problem.
I see.
So the other thing that I want to test with that is your feeling. So you haven't felt any tingling or numbness in your hands, nothing at all like that, huh?
No,
Even though the headaches have gotten worse, the arms haven't
my
gotten,
arms really haven't.
not involved at all,
No.
huh? All right, so I need you to close your eyes for a second.
Okay.
Now, am I touching you?
Yes.
Which hand?
Left hand.
Does that feel anything like this? Same or different?
Very similar.
Okay, so that's the back of your hand. Now, if you turn your hand over, how about this right here?
Mm-hmm.
How does that feel compared to that?
This one feels a little more sensitive.
Which one?
The right one.
The right one, huh? How about if I get your fingertip?
About the same.
Not the same. How about this finger?
Maybe a little more sensitive.
So the right side is more sensitive here and here.
Yes,
How about over on this side of the hand? Do you feel that?
I do feel that.
How does that feel compared to that?
Very similar.
Is there a difference?
Yeah. No, I wouldn't say so.
So about the same then?
About the
That
same there.
and that are about the same
Yeah.
then, huh? Gotcha. So the nerve that goes to this part of the hand might be a little bit more sensitive. Is that what I'm...
That's not, yeah, that's
Both
interesting.
here and also the finger?
Right.
Uh-huh, okay. While we're at the studying your nerves, let me get you to do this too. Just let your arms be nice and relaxed
Okay.
there. There you go, sir. This is two of the reflexes that we normally check. Now, I want you to just rest your arm on my hand there. Actually, it might be better to do it on this side.
Okay.
There you go. You nice and relaxed there?
Mhm.
This is called the triceps reflex. Again, I'm just looking for differences in one arm compared to the other.
Mhm.
Gotcha. Okay, good. All right. We'll be checking those on your legs after, but I want to check some other things here first.
Okay.
Okay. Alrighty, can I get you to swing your feet up there, sir?
Feet up this head?
Yeah, just swing your feet up, but that's it.
Okay.
But if you wouldn't mind staying sitting up. There
Oh,
for me.
okay.
Yeah. So you smoked for 20 years. Did you ever get much trouble with your lungs over those years?
I did cough a bit. I
Did
can
you really?
remember, yeah.
Smoker's cough.
Smoker's cough, I guess.
When you quit smoking, did that leave?
It went away.
That went away, huh? And as far as you can tell, do you have as much wind as anybody else when going upstairs?
I think so. Anybody my
Me
age,
too.
at least.
Gotcha.
Yeah.
Gotcha. Okay. Would you take a good deep breath for me? That's great. Now I'm going to come to the other side here
Okay.
because I want you to actually. Do you mind swinging your feet back over that side
This
of the
way?
table again?
Okay.
Yeah. Yeah. I want to just watch your breathing pattern here, and so
Okay.
let me get you to take a really good deep breath. That's great. And do that again. Nice and symmetrical there, huh? And you can just breathe normal while I poke at you for a
Okay.
minute. Can I get you to really take a very deep breath and then hold it? That's great. And then let it out. Good. Okay, I'm going to get you to do that one more time,
Okay.
just in a second. Now take a really good deep breath. That's great. And hold it. And then let it go. Yeah, good. Okay. All right, so now I'll come back over that other side a second here. All right, now we can get you, if you don't mind putting your feet up on
Okay.
there. I'm going to do a little listening before I lie you down.
Okay.
All right, sir. About 6 good deep breaths. And just take your time. Good. And then twice more. That make you dizzy?
No.
Not so bad. All right, sir. Now I'm going to get you to lie down.
Okay.
A little bit warm in here, isn't it?
It is a little warm.
There you go. I'm going to pull this down so I can get to your ticker.
Alrighty.
There you go. But I'm also going to recheck your neck here now. I want to just see what your thyroid gland is all about. Can I get you to swallow when you get the urge? That's great. Ever have any kind of thyroid problems that you know of?
Not that I know
No.
of.
Huh? Okay. And then turn your head a little bit to the side because I want to look at the veins in your neck. There's a good one. And then take a good deep breath. Does that worry you doing all this stuff?
Does it worry me?
Yeah.
I wonder why you do it, but it doesn't worry me.
Well, the veins in the neck tell us a lot about the pressure in the heart.
Oh.
So normally when somebody's lying down and you see a vein, if they breathe in, they should be able to empty that vein.
I see.
If the pressures were too high in your heart, it wouldn't let it do that.
Did mine empty?
Nicely.
Good.
Yep. Now I'm just feeling for your heart's activity here. Seems nice and quiet.
Mm-hmm.
Sounds pretty good.
Good.
All right, sir, can I get you to sit up now for a minute? There's a few more things I want to check. Just want to listen to your heart again, so if you just breathe normally. All right, sir, one more thing. There's I want to listen to your lungs one more time, but I'm going to
Okay.
make you do some talking.
Okay,
So the first time, I want you to just whisper the word E,
okay,
all right? And I'm going to listen every time I put my stethoscope on your chest, so.
okay. E, E,
Good.
E, 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 E,
Good.
E, E.
Very good. Then the other thing, I'm going to go around the other side of the table because I want to actually feel how the sound from your voice comes through to your back. We call it tactile fremitus,
Okay,
more doctor terms.
yeah.
All right, so say 99.
99, 99, 99, 99.
Good. Okay. All righty. Okay, sir. Good. Now I'm going to get you lie back down once again. All right, so now I want to examine your abdomen. I'm going to listen first.
Okay.
And I'm going to listen to where your arteries, big arteries are.
Okay.
Sounds nice and quiet like it should.
Sure.
All right, sir. So a little bit ticklish, huh? All right, sir. Now just let yourself be kind of at ease there. There you go. That's now you can. Is that okay?
Yeah.
We're getting there a little bit, huh? All right, sir. Now, when you get the urge, I need you to take a good deep breath. There you go. Once again. Good. Excellent. Okay. So your liver is about 8-10 centimeters in height. That's pretty healthy. Can't even feel your spleen, which is the way it's supposed to be.
Good.
So good appetite and heartburn once in a while, but otherwise you don't experience any abdominal discomfort then, huh? Gotcha. All right, sir. All right, that looks pretty good there too. And cough for me for a second. Sometimes people with larger belly buttons get hernias, but have you ever had any kind of bulging in there?
No.
Nothing like that, huh? Okay, good. All right, sir, now I'm going to get you to sit up again
Okay.
and swing your feet over the side of the table.
Okay.
Okay, now I just want to check one more thing. Any soreness in there?
No,
Does that hurt?
no,
How about that side on that side?
no.
Nothing at all, huh?
No.
Okay, good. That's called your costovertebral angle. It's where the kidneys sit.
Mm.
We always like to see if the kidneys are hypersensitive, which is pretty good. All right, sir, good. Now, a few more things I want to do. First thing is, I want to just get a look at your hands here. That's okay. So this is the area this is the base of the thumb that you're talking about, huh?
Yes.
Gotcha. And your mom's got arthritis, but mostly in her hands, huh?
Yes.
Yours look pretty healthy. Is this sore? Is this actually tender?
It's a little tender right in there.
Just a little bit
Yeah,
right in there,
okay.
huh? How about the wrists? Any soreness in there? No. Elbow?
No,
Inside or outside?
no.
These two spots don't hurt?
Mm-mm.
And let your arms be just kind of relaxed. This is the roof of your shoulder here. This is your spine of your shoulder blades. No soreness in there at all?
No.
No, nothing like that. How about up here in the biceps tendon?
Mm-mm.
No soreness in there either then, huh? True, okay. And we checked your function up there before and your hands before too. Now I want to pull this up so we can see your knees. So there's your, so heal pretty good, huh?
Yeah.
Those scars.
Yeah.
And how old, 2 years old did you say?
2 years
they were?
old.
Gotcha. So are you tender at all? 'Cause I'm
It is
actually-
a little tender, but not
Which one's tender? Both of them?
both of them. But I don't think for what you're going to do, it's going to
All
hurt.
right, and you'll let me know that, huh?
Yes, I will.
Can I get you to just fully extend that and flex it? Any trouble doing that?
No.
And do it with my hand on there if you don't mind. There you go. Back and forth. There you go. And let's do that one too. if you don't mind. That's great. So you had both of these done at the same time then, huh?
Correct.
Gotcha. Any soreness in these areas right here?
No.
Nothing there, huh? And let your arms, your legs be just kind of relaxed there. Ever have any discomfort on the back of your knee?
No.
I'm gonna sneak my hands in there a little bit. Gotcha. Now let me dab this foot here too. So move your foot first, toes up, toes down, all the way. And then can you turn your toes in, your foot in and out like that? Yeah, good. And do the same thing here. Actually, do them together. Let me see how that looks like. Just pull them up.
Up.
Yep, down, in, and then out. Go back and forth like that. Good. Okay. Now, will it hurt to use this on those
I
knees?
don't think so.
Let's see. Let me get it from this side here. There you go, sir. So you're nice and loose.
Okay.
There you go. No trouble with those reflexes,
No.
huh? Then I'm going to do your ankle reflexes.
Mhm.
Good and healthy. Good.
Okay.
And I want to check your feeling down there too while we've got you on the table.
Okay.
So let me get you to close your eyes.
Okay.
How does that feel? Can you feel that?
Yes, I can.
Which leg am I touching?
My left leg. My right leg.
You're right. Does that feel the same?
Yes.
Any difference from one side to the other?
No, it feels about the same.
How about here and here?
About the same.
Mm-hmm. How about there?
I can feel it on the right leg.
On the right leg. There?
Yes, on the left leg.
How about on the top of the foot?
I feel it on the left foot
Uh-huh.
and the right foot.
Do they feel about the same?
Actually, the right foot on the top didn't feel as sensitive as the
About the
left
same.
foot.
Okay, let's do that again. That and that.
I feel it more on my left foot.
So the right side has a little bit more perception, huh?
Mhm.
I'm gonna borrow your foot here now, and I'll do it this way, so a little bit easier. Do you feel that?
Very lightly.
Very lightly. Let me just compare that to this side here.
I feel it more on the left side.
So the top, it's
It's,
more sensitive on the top, and on the right side. On the left, the bottom's more sensitive.
no, actually, I feel it less on the top and the bottom than I do on the left foot.
Okay, let's do that one more time.
My verbiage was
So that, how does that feel compared to that?
lighter.
So this is lighter on the right side.
Yes.
How about the bottom of the foot?
Again, lighter.
So lighter on that right
Yes.
side. Okay. All right, sir. One more thing on the neurological exam I want to check. So if you just sit there and be kind of relaxed, there's a few more things I want you to do. First of all, bite down and hold your teeth real tight. There you go. And open your mouth wide and do that. And stick your tongue out. Can you put your tongue to the right, to the left, up, down? Okay, good. All righty. Now I need you to shrug your shoulders. In fact, hold them up for me. There you go. Okay, good. All right, sir, and one more thing. First, I want you to make your brow wiggle. There you go. Now, can you smile? There you go. No trouble like that. All right. Now, keep your lips pursed and blow real hard for me. That's what I want to see. Good. All right, sir. Okay. And then now I want to examine your function, your strength. I'm going to need you to stand up.
Okay.
Can we put that gown aside?
Yeah, that'd
You
be
comfortable
fine.
with that?
No
All right, sir. There you go. Now, the first thing I'd like to do is just pantomime, do what I do.
Okay.
Pick up that leg like that. Can you pull it up real high? Any problem with that?
No.
Kick it out?
A little tight kicking it out.
A little bit tight, huh?
Yeah.
That's pretty good for having that knee fixed.
Uh-huh.
How about that right side, sir? Same thing? No trouble doing that?
No.
Gotcha. And how much can you safely squat? And then come back up? Any trouble with that?
No.
No. Okay, and then I'm going to get you to lie down again if you don't mind.
Okay. Up here?
Yes, sir.
Okay.
Let me just finish up this part of the exam here. Too. So now let me do it this time.
Okay.
I want to just see how much, and if I hurt you, let me know.
Okay.
Does that hurt your knee?
No.
Your hips at all? How about to do that?
No.
I'm going to do the same thing here. Any discomfort when I flex that hip or this knee? And no trouble going that far out, huh?
No.
Okay, good, good. All right, sir. Now I want to just check your pulses too. Let me borrow that. There we go. And then put your arms about like that. This is called your carotid. Feels healthy.
Good.
Now I'm going to get you to take a real deep breath and hold it. Good. Good. All right, sir, I want to just recheck these pulses and then your leg pulses. We're almost finished.
Okay.
Excellent pulses.
Right.
Yep. All of your pulses are excellent.
Good.
Good. Good. And then a few more things here, and then we're almost finished. I'm going to make this vibrating test again.
Okay.
And what I want you to tell me is if you feel the vibration.
Okay.
And then I also like to know when the vibration goes away.
Okay.
All right? Can you feel that?
it. Gone. Feel it. Gone.
Okay.
Feel it. Gone. Feel it. Gone.
Okay. And then finally, now I'm going to move your fingers, and I want you to tell me whether I pick your finger up or down.
Okay.
All right?
Up. Down. Down. Up.
Mm-hmm. Same thing with your toes.
Up. Down. Down. Up.
From there. Okay, good. Well, let me see if I got everything that I need. Yeah, just a couple more things. You didn't realize I was going to make you work this much, did you? All right, sir, I'm going to get you to sit up, and then I'm going to get you to stand up.
Okay.
And if you don't mind, what I'd like you to do is just walk over to that lamp post and come back. Mm-hmm. Good. All right, sir. And if you do that one more time for me, except this time, I'd like you to do it 1 foot in front of the other like that.
Okay.
All right? Across and back. All right, sir. Excellent. Now, if you just face me, and the final thing is I want you to put your arms in front of you and hold your arms right there and close your eyes. Keep your eyes closed. I'm going to touch your chest, but keep your eyes closed. There we go. Okay. It's called the Romberg test. Good. All right, sir, you can sit down, and I think we're all set.